My name is Dr. Lubnasaifullh Khan, and if you have ever felt a sudden sharp pain shooting through your jaw, stopping you in the middle of your work, your meal, or even your sleep, then stay with me because what I'm about to share can literally save you from one of the most common yet most ignored dental problems that silently destroy the teeth from inside. Toothache is not just a simple pain. It is a message from your body that something deeper, more serious, and more dangerous is happening beneath the surface. And today, I want to walk you through every important detail from causes, infections, early warning signs, and symptoms so that you never reach the stage where the pain becomes unbearable. Every day, I meet patients who say, "Doctor, the pain started suddenly," but in reality, tooth pain never starts suddenly. It builds slowly, layer by layer, like a fire smoldering underground before it bursts into flames. And understanding this process is the first step toward protecting your oral health. One of the biggest causes of toothache is tooth decay, a slow destruction of the enamel due to bacteria that feed on leftover food and sugars. When these bacteria multiply, they produce acids that gradually dissolve the enamel, creating tiny holes called cavities, which expand deeper and deeper until they reach the dentin and eventually the nerve of the tooth. When the nerve becomes exposed or inflamed, the pain becomes sharp, throbbing, and intense. Another major cause is gum infection, also called gingivitis or periodontitis, where plaque buildup irritates the gums, causing swelling, bleeding, and sometimes a dull, heavy pain that feels like pressure is pushing on the roots of the teeth. Many people ignore bleeding gums, thinking it's normal, but it is actually one of the earliest red flags of infection. Another serious cause is pulpitis, which is the inflammation of the soft tissue inside the tooth. When bacteria reach this inner chamber, the pulp swells. But since there is no space for expansion, the pressure increases, causing severe pulsating pain that worsens with hot, cold, or sweet foods. Sometimes, toothache develops because of dental abscess, a pocket of pus that forms when bacterial infection spreads to the root or surrounding bone. This is not only painful but dangerous because if untreated, the infection can travel to the jaw, throat, or even bloodstream. Many patients also experience pain due to cracked teeth, where a tiny fracture invisible to the eye exposes the nerve, causing sudden stabbing pain when chewing. Grinding teeth at night, also known as bruxism, is another silent cause of constant dull pain because it wears down the enamel and strains the jaw muscles. In some cases, sinus infections produce pain that radiates to the upper teeth, confusing people into thinking they have dental problems when the real issue is sinus pressure. However, infections inside the mouth behave differently when bacteria invade the gums, roots, or bone. Toothache can arise from several causes. The most common cause is dental cavities, which occur when plaque and bacteria gradually erode the enamel, leading to sensitivity and pain. Another major cause is gum disease, also known as periodontitis, where infection and inflammation of the gums can lead to discomfort, swelling, and even loose teeth. Toothache can also result from tooth infection or abscess, which is a collection of pus caused by bacterial infection that can spread to surrounding tissues if untreated. Other causes include tooth fracture, impacted wisdom teeth, bruxism teeth grinding, and sometimes even sinus infections, which can radiate pain to the upper teeth. Ignoring minor discomfort can escalate into severe pain, swelling, or fever, so early attention is critical. The signs and symptoms of toothache can vary depending on the underlying cause. You may experience sharp, throbbing, or constant pain in one or more teeth, sensitivity to hot or cold foods, or pain while chewing, swelling of the gums or face, redness, or tenderness around the affected area can indicate infection. In cases of abscess, you may notice pus, a bad taste in the mouth, or even fever and swollen lymph nodes. Some people feel referred pain in the jaw, ear, or head, making it essential not to ignore persistent discomfort. Even mild symptoms, like intermittent sensitivity, should be checked to prevent more serious issues. If toothache is left untreated, it can lead to complications such as severe infection, tooth loss, and damage to surrounding teeth and jawbone. Chronic pain can also affect sleep, nutrition, and overall quality of life. Therefore, understanding treatment options is vital. For minor toothaches, maintaining oral hygiene, using saltwater rinses, and over-the-counter pain relievers can provide temporary relief. However, professional dental treatment is often necessary. Fillings, root canal therapy, or extraction may be required for cavities or severe infection. Gum disease may require professional cleaning, antibiotics, and sometimes surgical intervention. In all cases, timely treatment prevents further damage and restores oral health. Additionally, maintaining a routine of brushing twice daily, flossing, limiting sugary foods, and regular dental checkups can prevent most toothaches. Remember, prevention is always better than cure. Early recognition of symptoms, prompt professional care, and proper oral hygiene can help you avoid the discomfort and complications associated with toothache. So, if you ever feel persistent or severe tooth pain, do not delay visiting a dentist. Protecting your teeth today ensures a pain-free tomorrow. I hope this video helps you understand the causes, signs, and treatments of toothache thoroughly. This was Dr. Lubnasaifullh Khan. And if you found this information useful, please like, share, and subscribe to my channel for more health tips and educational videos. Thank you for watching.